Welcome back to the PA Mastery Method. We are going to go through the surgery PAEA topic list for the EOR. I've pulled together about 25 questions for you. This is part 6. Be sure to check out the other parts as well. This is going to help a lot with your active recall when you're studying. What diagnosis is confirmed by anti-mitochondrial antibodies? So this is going to be for primary biliary cholangitis. What is a common symptom associated with chronic mesenteric ischemia? This is going to be both food aversion and weight loss. What is the initial test to diagnose carcinoid syndrome? You're going to do a 24-hour urinary 5-HIAA. What is the most common bacterial cause of empyema? It's going to be strep pneumoniae. That's also the bug that's causing most of our community-acquired pneumonias. So for community-acquired pneumonia to turn into an empyema, which is just pus accumulation, we would suspect the same culprit. What is the strongest indication for mitral valve surgery and chronic mitral regurg? We're going to do our New York Heart Association classifications and anyone above a class 3 and above. If a mass is found on colonoscopy, what's the next step? We're going to do a biopsy, and you're also going to tattoo it so that later on the surgeon has a nice time finding it, or if there is follow-up imaging done. Where does colon cancer usually metastasize to? Usually goes to the liver and the lungs. What is the most aggressive type of lung cancer? Our small cell lung cancers are the most aggressive. If patients are either not caught or not treated for it, they might only survive about 6 to 18 weeks. What is the difference between primary hypothyroidism and Hashimoto's? So just remember that with Hashimoto's, there's going to be a family history. They're going to have a goiter and they're going to have neck tenderness. Primary hypothyroidism typically doesn't have as many symptoms, and we really just see those levels on labs. What medication is used for acute treatment of hyperthyroidism? We're going to use atenolol. The thioamides are correct answers as well, but they're just more for longer term, so that's why atenolol is used for the acute phase. How do you treat hyperparathyroidism? You're going to actually have to remove the parathyroid. So it's a parathyroidectomy. What conservative procedure do we do before a hemorrhoidectomy? So before removing them, we're going to do a rubber band ligation. This is considered a conservative in-office procedure before we put the patient into a surgical setting for the hemorrhoid removal. What is the next step for a large hiatal hernia that is refractory to medications? We are going to do a surgical laparoscopic fundoplication. Which two bacteria are associated with acute diverticulitis? It's going to both be E. coli and then Bacteroides fragilis. What condition has sudden unilateral vision loss and a cherry red spot? It's going to be our CRAO, the artery occlusion. What is the initial test for amaurosis fugax? Let's do a carotid Doppler ultrasound. This is going to be looking for carotid artery stenosis that might be decreasing the perfusion to the brain and to the optic arteries and such. What is the imaging of choice for pancreatic carcinoma? The imaging of choice is a helical CT of the abdomen. Which bacteria causes empyema and lung abscesses? This is going to be Staph aureus. So remember, with just our empyema, we're thinking more strep pneumoniae, but if we start developing an abscess, it's more likely to be Staph aureus. Which lung cancer is associated with paraneoplastic syndromes? It's going to be your small cell lung cancer. What is the best test to confirm carpal tunnel? We're going to do a nerve conduction study rather than an EMG. Which cranial nerve injury with thyroidectomy causes hoarseness? It's going to be an injury to the recurrent laryngeal branch of cranial nerve 10, which is the vagus nerve. What causes cyclical mastalgia? It's going to be due to the increased progesterone during the follicular phase into the luteal phase. Why does acute pancreatitis cause hypocalcemia? This is due to sponification or saponification, where essentially the fatty acids are going to bind to calcium and they become these like insoluble soaps, and so lowers the calcium. What is the surgical intervention for a perforated peptic ulcer? We're going to do an exploratory laparotomy and lavage. What is the first step in an aortic dissection treatment? We're going to want to do a beta blocker before a vasodilator to help lower the blood pressure before we go in and increase the perfusion. All right, that is all for now. Don't forget to subscribe so that you can stay current with all the videos that are going to be coming.